I am Nicole Mattocks. I'm a research assistant professor here. I am conducting research in a number of areas, mostly right now focused on behavioral health services, systems and interventions. Well, I do teach. I adjunct. I teach the research methods course for foundation students. So one of the studies I'm working on, I run a research project called Medherent that is funded by NIMH, and it's a study evaluating the effectiveness of an intervention, a telehealth intervention. So it's a device that is about this big and installed on the walls of people's homes. It's for people with individuals with serious mental illness, and it's a device that basically works like a vending machine. It dispenses their medication in these pre-packaged little packages, and so it helps them kind of adhere to their medications. It gives them more independence because they're able to get an alarm goes off that tells them it's time to take their medication, and then so it helps with their adherence. In the project, we interview people with serious mental illness, and we learn about their psychiatric symptoms, their adherence to their medication. We also use the device data, so from the Medherent machine, to tell us how adherent our participants are to their medication. So a lot of them have many doses and many medications that they're taking throughout the day, and it's hard for them to keep up with everything for a variety of reasons. And so the device is supposed to help them with all of that, and so far we're finding that it's been very effective. And that study is funded through April of 2022, or through March of 2022, ending beginning of April. So that one is, I think, it's a really innovative intervention. I think we'll be seeing a lot more of this type of telehealth service, and this project is also presenting a lot of other opportunities to keep expanding use of the device. So me and another faculty member, Dr. Jay Unick, are applying for a number of different grants to see if we can add more functions to the device and use it also as kind of a digital health home, so that people can have, for example, appointments with their psychiatrist or other medical providers using the tablet that's embedded in the device. So that one's pretty exciting. I think it gives the participants, people with serious mental illness, the opportunity to become more independent, to feel more sense of agency over their managing their medications. It also gives the staff that are usually doing a lot of the direct observation and medication management tasks, it gives them a lot more time to do other things when the device is actually functioning how it's supposed to. So it's both an intervention for the participants, but also for the agencies, the community mental health agencies and staff. So it's a pretty exciting project, and I think there's going to be a lot more opportunities for Medherent moving forward. We received the grant and started it well before the pandemic, so it just happened to kind of line up with this pandemic, which of course really made it difficult for people to have interaction with staff. People were having to reduce a lot of contact, obviously, and so this device and other devices like it are going to, I think, especially with the pandemic, going to become more common, especially through agencies, through behavioral health providers. So there's some effort right now, actually, to have the state start subsidizing the cost of the device, so that instead of the pharmacy company that actually makes the device paying for each device and paying for all the upkeep, the state of Maryland might at some point be willing to subsidize that cost, and it could make the device more widely available to people. And so, yeah, when people are living in remote locations, there are plenty of rural areas in Maryland where people have, transportation issues and just general, difficulties getting access to their services, behavioral health services. But I'm involved in another project called IRIS that builds research infrastructure in behavioral health settings. And so basically there are a lot of agencies throughout the area that provide opioid recovery, treatment, and services to people who are struggling with opioid use disorder. And we're in the process right now of wrapping up our first year on the project, and we have 3 more years of funding to develop a research infrastructure around opioid recovery. And so what that actually means is that we're partnering with lots of community agencies, so it's an academic community partnership grant funded by NIDA, and we are working closely with all these community agencies that are serving people with opioid use disorder and dependency to help them evaluate their work. So basically, there are a lot of agencies that are doing really good work but don't know how to do the research to demonstrate that their work is effective. And so we as academics are partnering with some of these agencies to provide really hands-on technical assistance and sometimes just kind of general guidance, but also grants, up to $25,000 grants to some of these agencies to develop more of an evaluation arm to their service so that they can demonstrate to other funders, demonstrate to the state that their work is effective and helping people recover from opioid use.